Hello, everyone. I hope you are doing well. My name is Dr. Davina Liggins, and I'm with Healing May Whole. And today I want to talk about the issue with using insulin to treat type 2 diabetes. Here's the reason why insulin long term tends to make the disease worse. Okay, insulin in terms of the medication tends to make disease worse in terms of type 2 diabetes. Why is that? Well, we have to understand the root cause of type 2 diabetes. What is causing it? I always talk about it, it's insulin resistance. But here's the key with insulin resistance. Insulin resistance is always associated with high levels of insulin. Okay, so type 2 diabetes is not the result of the lack of insulin. It actually occurs because insulin is too high. And the body says insulin is too high. Insulin is not supposed to stay high at these chronic high levels all the time. That's that hyperinsulinemia that I always talk about. And the body says we're not supposed to be responding to that. Another issue is that the cells themselves have a high level of glucose already on board. It hasn't even used all the stored glucose that it has. And it says we're too full. We can't take in any more glucose. That's one of the key things that insulin does. It signals the cells, like muscle cells, to take up glucose from the blood into the cell to use it for energy. And the cell says we're full, we're jam-packed. And it starts resisting. So that is why. And so let me just back up. Let me continue my thought for a second. So here's what happens. Because insulin is high and the body, or the cells in the body are saying, no, we're too full. At least some of the cells, not all the cells, are resistant. But for example, the liver, the muscle, the fat can become resistant. And it says, no, we can't take anymore. We're not going to respond to that insulin signal. And the pancreas starts putting out even more insulin to drive the cells to take up insulin. And then the cells become resistant to that and says, oh, we don't want to respond to this much insulin. And then even more comes. And that whole cycle drives the disease forward. And it makes prediabetes, that's the outcome of prediabetes, and then type 2 diabetes. And so what happens is when you're administering yourself insulin, in a state where insulin is already too high, it drives insulin resistance even more. And this is why oftentimes individuals with type 2 diabetes, they'll find that they'll start off with a lower amount of insulin. And then as time goes on, they have to take even more to maintain whatever blood glucose level that they had at that initial time. That is insulin resistance. Insulin resistance means that you need even more insulin to get the job done. In this case, get the glucose out of the blood and into the cell. So this is why I always encourage lifestyle changes. Why? Why lifestyle changes? Because myself, as a nutrition and lifestyle counselor and coach, what I do is I look into the lifestyle of an individual and I start looking for what are the clues, what are the foundations in this person's life that is causing insulin to stay high. Oftentimes, is diet at the top of the list. High carb diet, frequent eating, high stress, not enough sleep, all these things drive insulin resistance. So what do? We reverse all of that. And we start making some serious lifestyle changes that allow insulin to come down. So I'm actually doing the opposite of what modern treatment does. Okay? That is what you call creating health and not managing disease. So we have to be honest about how we are managing disease, how we are treating it. Is it really making it better or worse in the long term? So here's how you do it. You work with your doctor and you say, hey, my goal is to actually reverse type 2 diabetes. I'm aiming to do that. I'm making lifestyle changes. I'm changing the foundation of how I live so that I can regain insulin sensitivity. and you work with your doctor as you are changing your lifestyle. You're working on stress, you're improving your sleep, you're making sure you're not eating too often, especially often as in high carb foods. You're very low, if any, on the ultra processed foods. And as you start making those lifestyle changes, you'll see that the need for insulin starts to decrease. And you work with your doctor on getting off of insulin. Now remember, as you are removing that, you don't stop until you don't rest and say, oh, the type 2 diabetes is over. Okay? Until you make sure insulin resistance is gone. Why? Because we are aiming to take out the root of the disease. Okay? And remember, that's getting that fasting insulin test, and that's getting the HOMA-IR test, the test of insulin resistance. And the whole goal there is to make sure that not only type 2 diabetes is gone, but the root is gone. And you want to make sure your lifestyle is in place to maintain that. And trust me, you can do it. Okay? So I want to encourage you to make those lifestyle changes, because in all honesty, there's no medication out there that can reverse the result of a poor diet or a poor lifestyle. You've got to change your lifestyle. You all take really good care, and I'll see you the next time.